Hi, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions from our patients about smile makeovers, so I'm here today to answer a few of the most common questions we get on the topic and to see if a smile makeover might be right for you. So the first question we get is, what exactly is a smile makeover? So a smile makeover basically involves any treatments that we're going to be doing to give you a better smile, to give you a more natural looking smile and something that you are going to be happy with. It can involve several different procedures individualized based on the specific patient, but our ultimate goal is that you're leaving with a nice smile that you're confident in.
Beautiful. Doctor, are smile makeovers considered cosmetic or restorative dentistry?
So patients will then ask, are smile makeovers considered cosmetic or restorative dentistry? And really they kind of involve a little bit of both. So depending on the certain condition that we're in or the certain state of a patient's mouth, we're gonna look at different treatment options in order to get them back to that full healthy smile. One of the goals we always have is not only we want your smile to look great, but we want it to last as long as possible. And that really means that we need to get the function of your bite proper so that all of the treatments that are in your mouth are gonna last long term. So next, patients will ask, what are the goals of a smile makeover? The main goals that we have, of course, as the patient, they always want their teeth to look as good as possible. They want to be confident and have good self-esteem based on their smile. For me as a dentist, the other important part of this is making sure that you are functioning correctly so that all your teeth are biting. We have all of your teeth that are going to support, because you actually do about 80% of your chewing with your back teeth. So if we only focus on the front teeth, shortly those are going to break. So I want to make sure that the back ones are touching properly. When you're grinding around, you're eating your food, that nothing is going to chip on us, that it's going to last as long as possible. So next is, who would be a good candidate for a smile makeover? So that's really going to depend on the individual situation. Typically, though, we're looking for patients who are about 25 or older. For younger patients, we're usually going to be trying to address their smile issues through orthodontic treatment with like Invisalign or braces. But for our older patients or who maybe are not interested in orthodontic treatment, we certainly would take a look and see if a smile makeover is an option for them. So next is, what are the procedures that are usually involved in a smile makeover? So one of the common ones that most people will think about when they hear a smile makeover is doing veneers. So that's like a little porcelain cover that goes over the front teeth. But other procedures that could be involved would be like doing full crowns on teeth in the back that are more broken down. Or let's say a patient is missing teeth, then we look at doing dental implants, which is like a little artificial root that goes into the bone with the tooth part on top, or bridges, which can basically bridge the gap between two missing teeth. Sometimes we might also look into involving dentures, something that's called an all-on-next denture, which involves implants in order to support that denture. So there's a whole bunch of different procedures, but we would do an exam to see what's right for your situation and then talk about the different options from there. So patients are often worried, will I need anesthesia during my smile makeover? Again, depending on the procedure that we're doing, we would make that decision, but most of the time, yes, we are going to need to give a little bit of anesthesia. It's the most important thing for me is that I want to make sure you're comfortable as a patient getting the treatment done. I know the needle's not everybody's favorite part, but it is a lot better than you having to be in pain during the procedure. And it's very quick. We'll do everything we can to give it as gently as possible so that you feel as little pain as we possibly can. So patients will then ask, how long will it take to heal from a smile makeover? So again, this does vary depending on the procedure that we're doing, but for the majority of the time, it's going to be a few days. Your gums might be a little bit tender after the procedure. After that, though, things heal quite quickly in the mouth and you can get back to using things as normal. So patients will ask, can I resume regular brushing or flossing after I've done my smile makeover? So that's something that we will cover with you as we go through the treatment. When you're in the temporary phase, it might be a little hard to floss in between, depending if we do have to connect some of the teeth together. Certainly, we want you to continue brushing so that we keep everything healthy. Once we're done with the procedure, yes, we definitely want you kind of getting back to normal brushing and flossing. If you have a certain procedure, like say a bridge, there's certain different techniques you might have to do with the flossing, but we would cover that with you once you're done. Okay, so I hope I was able to answer some of your questions about smile makeovers. If you do have any additional questions or you are ready to take action, please feel free to reach out to us at 204-817-6768, and we'd be happy to help you.